Hi, I'm Dr. Catherine Inoha at the Natural Medicine Center in Lakeland. And this video is on polypharmacy, especially psychotropic meds, and over-medication. As a licensed pharmacist for a couple of decades, and that's decades plural, I've seen a real pendulum swing in prescribing habits. And the recent trends favor a new practice of over-medication, and that is especially true in children. In the United States, we medicate children at 300 times the rate that Europeans will typically embrace for their children. When I was a young pharmacist, the idea of giving potent psychotropic drugs to children, that was taboo. It was not practiced at all. And it's not only psychotropics. It's a broad expansion of over-medication. Now routinely as a pharmacist, I see patients are given 2 stomach acid controlling drugs with different mechanisms. And routinely, I see 2 antibiotics. So the pendulum has just swung completely to the side in favor of copious prescription drugs. And it begs the question, at what point can our liver not tolerate this high quantity of prescription drugs? What I routinely see now in youth is an ample prescription of stimulant drugs, so that would be Adderall, Ritalin, Focalin, an ample use of SSRI antidepressant drugs in children, and even beyond that, I'll often see Abilify prescribed for agitated depression. I'll see Seroquel or other tranquilizing agents added in children. This never was the case before the late 90s is when this new practice rolled out. And to address the question of whether there's wisdom in the use of psychotropics in children, I would refer you to search this website and look up some of the blogs that I've provided, but also to look at the wonderful work of some of my favorite authors. So if you could look at the magnificent work of Robert Whitaker in his book, Anatomy of an Epidemic. Also, take a look at Pharmageddon, a recent book by David Healy. And thirdly, the very excellent work of James Davies when he wrote the book Cracked, The Unhappy Truth of Psychiatry. So my background is extensive in terms of the training on psychopharmacology. I'm board certified in psychopharmacological med adjusting. If you have a child or a loved one, and some of these comments I've just stated about the over-medication of American youth, some of these comments are ringing true for you. I want to warn you that you cannot come down from a high dosage of such medications as I just mentioned, Adderall, Ritalin, or the SSRI drugs, or Seroquel. You cannot come down safely with just an abrupt pause. And I would like to be instrumental in helping you to slowly taper down. If you believe that dietary changes and cognitive therapy approaches and alternative and complementary approaches to healing your child or loved one. If you'd like to try that, please schedule an appointment. Now, as I will go through with you in our one-on-one consultation, and as the books I just mentioned by Doctors Davies, Whitaker, and Healy will point out, there is ample evidence to show, and even the World Health Organization and FDA itself has recognized that these strong psychotropic drugs in children or young adults can lead to aggression, lead to psychosis, can promote more readiness to develop OCD and ODD types of disorders, can lead to suicidal thoughts. And when the FDA became aware of these outcomes, when such meds are used in children, they even endorse the use of a black box warning. And the black box warning is now alerting all parents or guardians for young adults that psychotropic drugs such as the ones I've listed can cause an increase in suicidal thoughts when given to young people below the age of, say, 25. Some statistics. Statistics can be helpful. The agencies that I mentioned, FDA and WHO, they've already proven that there's been a 580% increase in the use of stimulant and psychotropic drugs in the population of children age 6 and under. That was between the time frame of 1995 to 1999. Beyond that, we saw a somewhat less profound increase of 151% in the age 7 to age 12 age group. Well, with the black box warning and many of the other findings from scholarly groups on the damage that these psychotropic drugs can be doing, it begs the question, why are doctors continuing to prescribe psychotropic drugs in young age groups? If you believe that you'd like to try a complementary and alternative path to de-escalate the use of these agents in your child or loved one, please schedule an appointment and I can guide you towards safely reducing the psychotropic drug burden that you now have in place. We can use herbals, we can use counseling, we can use cognitive therapies and find a more naturalistic route to resolving the symptoms in your loved one. I'd love to have you visit so we can talk with this more in person.